Hi, this is Gloria again from hupalo.com. In this video, I'm going to explain the potential causes of PCOS. If you are interested in learning more about PCOS and you haven't seen our previous videos, make sure you check out our channel where I explain the different PCOS symptoms and also the different PCOS phenotypes. We don't know the actual cause, or in other words, the etiology of PCOS. So this video will not give you a straight answer to the question. But I'm going to explain the different factors one by one, and hopefully it will help you to understand PCOS a bit more. So it is currently believed that both genetic and environmental factors contribute to the development of PCOS. But we still don't know a lot about PCOS. Just to give you a background, PCOS was only mentioned in 1421 by an Italian scientist who described that there are married women who have shiny pigeon-sized ovaries. And then the first publication only was published in 1935 by Stein and Leventhal, who specifically described the cysts in the ovaries. Then only in 1990 they set up the diagnostic criteria at a big conference. The problem with this diagnostic criteria was that only the doctors who were present explained what they seen in their patient and what they think the typical symptoms are. It wasn't based on systematic clinical evidence. Then the Rotterdam criteria was set up about 10 years later, and that is what is currently used. But it's still believed that there are many controversies in these Rotterdam criteria. If we, for example, compare it to diabetes, diabetes was mentioned before Christ already, and in 1921, insulin was already discovered to treat diabetes. And ever since, there had been lots of attention and lots of different treatment proposed for diabetes. If we compare, we don't even really understand why PCOS happens. So there is a long way to go for PCOS and for great treatments to come along. There are many challenges to study the inheritance of PCOS. For example, one is that there are many environmental factors that may interfere, or for example, there are many different PCOS types and all the women have different symptoms. But also studies struggle to recruit large families so that they struggle to link the inheritance through different family members. So far, there are several genes were identified for PCOS, but not a single one could be causative. With some other conditions, there is one single gene that often can be linked. If it's switched off, it's causing a condition. But with PCOS, it seems to be more complex. Very often, studies link PCOS to insulin signaling and insulin resistance genes, which might not be surprising, as you might know from the previous videos that many PCOS women have insulin resistance. And also many studies linked PCOS to an obesity gene called FTO, which might again explain why so many women struggle with weight loss. But none of the genes seem to be very strong, so the evidences are not very strong on these genes. According to a study conducted in southern Italy, low birth weight is a risk factor for PCOS because girls who were born with either low or normal low weight they were shown to have higher androgen levels. So low birth weight is below 2,500 grams, and normal low birth weight is below 3,000 grams. Another study, which was a systematic review, which is a study that collates lots of evidence, also found that girls who were born with weight below 2,500 grams, so low birth weight, also found that those girls have 1.7 times higher risk to develop PCOS. Generally, low gestational weight babies are linked to metabolic conditions, and it is believed that when this is coupled with environmental factors like poor diet or sedentary lifestyle, this may trigger insulin resistance and PCOS in these women. I personally definitely identify with this hypothesis because I was born with below 2,000 grams, and no one in my family, for example, known to have PCOS. There is no clear evidence, but animal studies shows that when the fetus is exposed to high anti-Müllerian hormone or testosterone, the baby later in life develops PCOS. Animal studies are not the best to explain what happens in humans, but very often it can help to understand how it may happen in humans. Although human studies found that when AMH, so the anti-Müllerian hormone, for that actually a marker that shows ovarian resolve, when this hormone is elevated, then leptin is higher in the umbilical cord, and those babies later show reduced glucose tolerance pre-pubertary compared to the controls. Leptin is, for example, responsible to store fat in our body. This, for example, could explain how, for example, girls could inherit PCOS from their mother. But then we also might ask, what was first, the chicken or the egg? Because that woman, for some reason, had to have that elevated testosterone and anti-Müllerian hormone. These hormones are very often elevated with women with PCOS. And then we might also ask how these elevated hormones affect boys, if it affects them at all, because it might affect them as well. It was found that most inflammatory markers are higher in PCOS women than the weight-matched control. So, for example, these inflammatory markers include CRP, so C-reactive protein, TNF-alpha, interleukin-6 and 18. And even when PCOS women were matched with non-PCOS women with the same weight, so obese women were found to have lower of these markers than the PCOS women. We know these inflammatory markers propose a higher risk for cardiovascular risk, for example, so it might explain why women with PCOS have higher risk to develop, for example, heart conditions, but we don't fully understand why it happens in PCOS, and also if these inflammatory markers maybe propose a higher risk to certain phenotypes. So, for example, you may heard that the classic type 1 or the type 2 is a more severe PCOS because they have stronger symptoms. There might be some women who have higher risk to develop PCOS when they change their lifestyle. So for example, when they start not performing physical activity and start to have a diet high in fat and refined carbohydrates, and it's possible that this may trigger insulin resistance and PCOS in some women. There is a strong link that weight loss can improve PCOS symptoms, but we want to emphasize that it's important how you find your way to lose weight and develop healthy eating habits, because often what we see that just following diets and just like unhealthy like weight loss tips, that often just can trigger more problems for PCOS, for example binge eating or other eating disorders. And also we often hear doctors telling to PCOS patients that in order to get pregnant they just need to lose weight. This is not just as simple. You need to find your tailored way, what really works the best for you and what really works for you to develop new healthy habits, and that could definitely lead to an improvement in your symptoms and can increase your chance of getting pregnant. The mostly studied endocrine disruptors for PCOS is BPA, a chemical that can be found in plastics and can leach into food and beverages. And animal studies have found that early exposure to this BPA can lead to neuroendocrine disruption and can lead to cyst development and higher androgen levels. Animal studies are not the best to study how humans react to certain things, so this is not a strong link, but some human studies also found that women with PCOS had higher BPA levels than the non-PCOS control, and this was linked also to this was correlated to the androgen levels. According to the Food Standard Agency, the BPA found in food and beverages are at the safe level for any age group, but it's possible that there are some populations, for example, women who might be at higher risk for these, or they're more sensible to these chemicals, and it's not possible to define these studies. For example, we don't really know how to define who is at higher risk of PCOS. So it is possible that only these women are more sensible to these chemicals. But there are certain things you can do to reduce your BPA exposure and also your family's exposure. For example, look out for BPA-free plastic, drink from glass bottles, and also if you have children or planning to have children, then look out for toys that are made without BPA. This is more theoretical, but similarly as we discussed with obesity, women with lower culture or socioeconomic background might be at higher risk to develop PCOS because they simply can't afford the right quality and quantity of food, and this might lead to the development of insulin resistance and PCOS simply because they can't afford healthier food, for example, whole grains, the right amount of fruits and vegetables. Not that theoretical there. For example, infertility had been linked to lower cultural and socioeconomic background. Also, infertility had been linked to low self-esteem and job satisfaction. So we know these things can definitely affect your chances of getting pregnant, although not linked to the potential causes of PCOS. If your PCOS symptoms like acne or irregular period affects your mood. You might be more, for example, you are more anxious because of these, then you might be at higher risk of infertility. Thank you for listening. We hope you found this video informative. If you like the video, make sure that you subscribe to our channel. In the next video, I'm going to explain about weight gain in PCOS. Also, if you have any questions, make sure that you leave a comment below and we will be keen to answer. And you can also sign up to our newsletter at hubella.com, where we are sending out healthy recipes. If you're on Instagram, you can also follow us at Hubella Official. See you soon. Bye.